Hello, my name is Lucas MacDonald, and I not only play a nurse here on the internet, but sometimes I get to play one in real life. I currently work on a medical cardiac ICU, and on our floor we are constantly monitoring our patient, from their cardiac rhythm to their O2 levels, their respiratory rate, even their arterial blood pressure is monitored, displayed, and recorded for analysis 24/7. When you work night shift, as I did this past year, this stream of patient data gives you ample information to make note of a patient's sleeping behaviors, in particular, their sleeping patterns, in their breathing while they are asleep. Through my own informal observations and discussions with my fellow night shifters, I came to the unscientific conclusion that lots of our patients suffer from obstructive sleep apnea, or OSA. I thought maybe because it's a medical cardiac unit, our patient population, which tends to be overnarked and is definitely overweight, might be giving me a skewed picture of the OSA problem. But the more I looked into it, I realized it was not a problem confined to our patient population. Now, estimates vary wildly, ranging from 3 million to 25 million people here in the United States suffering from OSA, and perhaps more than 100 million worldwide dealing with OSA and associated issues. And OSA is no joke. By interrupting your sleep pattern constantly throughout the night, on a daily basis, it saps your energy, dampens your mind, diminishes your memory, and even shortens your attention span. In the long run, it may have really deleterious health care consequences, as it increases the risk for cardiovascular disease, stroke, hypertension, CHF, diabetes, and GERD. Now, a big part of the difficulty in pinning down a more exact number of cases of OSA is due to the fact that it is widely undiagnosed and thus undertreated. Sleep studies at a specialty sleep center remain the gold standard for diagnosis, and in the hospital settings, continuous pulse oximetry has been shown to be helpful in picking cases up. But what are we as primary care providers to do for patients who come in with these symptoms? What are we to do to lessen their risk for the long-term health effects associated with OSA? Luckily, there is a simple diagnostic tool based on the risk factors associated with OSA called the Stop Bang. Stop Bang is simple, easy to use, includes no high-tech diagnostic tools, and many of its elements are already part of our general patient assessment. Stop Bang is an acronym for a series of yes or no questions regarding the risk factors for OSA. So let's look at those. S, for snores. Do you snore? Do you snore loudly? Do you snore loudly enough to wake your wife up? Tired. Are you tired all day long? The best example of this I saw was falling asleep at the wheel. Now, if you fall asleep while you're driving, you should be checked for OSA. Observed apnea. Oh, this may sound a little difficult to pull off, as getting someone to watch you while you're asleep, aside from night nurses, who will definitely be watching you, could be difficult. But if you get someone to watch you while you sleep, and they observe a few seconds of not breathing, you coughing yourself awake, or any sort of chortling, that is observed apnea. As for the pressure, that is blood pressure. Do you have high blood pressure? Are you being treated for high blood pressure? Then the bang. B for BMI. Is your BMI greater than 35? Are you officially obese? Age, greater than 50. Neck, as in neck circumference. Is it greater than 40 centimeters? Measuring from the Adam's apple and around. And then gender. Simply being male is a risk factor for OSA. Then how do we score this? So greater than 3 yeses to those questions puts you in a high risk factor. Less than 3 yeses, low risk. Very simple. So just to make sure everyone understands this tool, let's go back through it, and we'll talk about me as an example. S for snore. According to my wife, this is a definite yes. T, tired, except when I'm drinking coffee. O, observed apnea. Again, my wife, I asked her about this, and she's definitely seen me have periods of apnea. Pressure. My high blood pressure had a few readings here and there, but in general pretty well controlled. We'll say no for that one. BMI. Thankfully still less than 35. Age, less than 50. Neck circumference. Happen to have a handy tape measure here. Go from the Adam's apple, wrapping around, connecting up here. And what we get, ooh, very close, but still under 40, 39.5 centimeters, which falls just under, yes, for 40 centimeters. I think I have enough already. I don't need any more risk factors. Because the next one, gender, is male. Apparently by the time I'm 50, I will qualify for all of these. But right now, I count, I believe, 4 yeses, which puts me in high risk for OSA. Now, the pros of this tool are basically covered. It's easy to compute, it's easy to use, and it's generally effective in screening out patients for high risk for OSA. The cons are that it may be too generalized, that the scoring system could be further stratified into the low, medium, and high risk patients. The tool is also not diagnostic in itself, as a follow-up sleep study is needed for true diagnosis. In terms of relevance to our future practice, the Stop Bang Score tool is a simple screening for a condition that affects millions of Americans. And regardless of the exact number of Americans that may be, the everyday impact and the long-term health effects of OSA are just too large not to incorporate the use of the Stop Bang into our practice. Thank you all for watching, and thank you for a great semester.